deadly like that if you quickly take care of it. When you know you have fibroid, it's better you go for medication. You go to hospital. There's a way they will give you some drugs. After that, they will put you on maybe they are going to operate you. So and it's better you make sure the operation is being carried out. But I've seen instances that after the operation they still give back, they live well. And another problem is it's deadly in the sense that during their menstruation period, the blood that come out can lead to anything. So it's better to take care of it at the right time. Actually, they feel pain, oh, it's painful. But I always pity them. When for example, I have somebody around me that has anxiety. She normally feels the pain is so much. And she did not have the money to do the operation. That's another problem. So there is a way that government can come in and make it maybe 50-50 to reduce the money. I've known like 3 instances, it doesn't come back. Yeah, okay.
Okay, so those people that you know,
I've already given back to 4 children. Say, yeah, let me go and do it now. But at the end of the day, she was now after the operation, she got pregnant again. So the doctor was like telling her that is a perfect one. And she has given back to a bouncing baby boy. This government can chip in, even if it's not all the money, at least 30%. It will be of them.
I get the experience. My mama, the time wey I dey for secondary my mama get her like 2 years wey be say sick. The thing dey worry her wey dey nowhere wey no go. All the money wey carry come from Lagos wey carry go Oyo state that time, the thing finish. Then na one people even though dem dey go babalawo go everywhere, e just dey live and im belle dey be like say e get belle and im no get belle at all. But na one doctor na im dem come say make we go meet for Owodo at Oyo. Na the doctor come do the operation for am. That night I dey there because I be only daughter wey my mama get. When dem come say now as dem do the operation finish, when dem come say make I come look am inside bowl, the thing just dey be like ball, e dey fall. The thing plenty inside the bowl that time. As my mama comot am na im make am lose sick again. And since then, e still reach like maybe 2 years before e come die. But that time e dey for 70. But the thing no good at all. If person get am, make person go hospital. Instead make person dey call babalawo or wunmi or afam.
information gives knowledge. Knowledge empowers. An informed person makes an informed decision. Welcome to your one educative program that empowers you for a brighter tomorrow. I am your host, B to the A to the B to the R A on Staying Assured with Deborah. Today's program promises to be so informative, and you know, on this program, we discuss everything that affects your life, family, and your environment. Today, we'll be talking about the rising trend of fibroid in women. And we have an authority in this field to discuss this particular issue, and that's why we say promises to be very informative. Welcome to the program. Meet my guest today, Dr. Bolutife Idowu. You're welcome to the program, sir.
Thank you very much. My interest is to deal with issues of women, especially when it comes to the area of infertility, having children, having issues with conception, issues with problems of pregnancy itself, and issues with delivery. So those are my special area. I also have some interest in cancer treatment of women. So these are all encompassing things I do.
You know, women have a lot of challenges we go through. I'm not saying just women, but you know, for this particular segment, women have a lot of challenges we go through. But because we seek an effective solution to that challenge, That's why we always say, let's speak to an authority in that field. Okay, so today, like I said, we will be talking about the rising trend in fibroid in women. So, doctor, you'll be telling us more about it. Let's first of all know what fibroid is.
Okay, thank you very much. So, fibroid is a growth that is seen on the uterus of every woman, and I can tell you it's very, very common. About 8 out of every 10 women will have fibroid, and not all of them will have problems. But about 2 to 3 out of these 10 will have issues needing either drugs or medications of different sorts, or surgeries, or any intervention at all. Right? Fibroid is not a new disease. It has always been plaguing human beings. And in fact, if you look at the Bible very well, there was a story told by Dr. Luke in the Bible in chapter 8 of a woman who had serious bleeding disorder. And it was described that the woman had suffered a lot from the hands of physicians who didn't know about fibroid. So that is to tell you that it is not a new disease. It has always been around us. The only thing is that we started discovering what these problems are, and we have started attacking the problem.
Taking us back to the Bible, where fibroid was pointed out, but was not mentioned that it
It
was
wasn't,
fibroid.
well, it may not have been mentioned as fibroid, but looking at the description of what a woman was
Was going
actually
through.
suffering from, you will see that it was either fibroid or endometriosis that the woman actually had.
Begins to get a bit clearer to say 8 in every 10 women has that growth, but the growth may not be as dangerous as some.
Exactly.
Okay, and then this is not a new disease, so which means that everyone has it, but it's not as bad as some.
Exactly.
Okay. We noticed that lately people are beginning to point at fibroid here and there. If this is the case, that means even in young children too would also experience that.
Fibroid is a smooth muscle abnormality. It's a tumor that affects smooth muscles. And this smooth muscle can be found on the uterus, can be found on the heart, it can be found on the vessels and different parts of the body. It can also be found in the breast. That's why some people have breast lumps. All right. This particular one that is found on the uterus is called fibroid. All right. And it appears there are some hormones that predispose to having this condition. One of it is estrogen, and another one is progesterone. Now, for children or adolescents who have not had a prolonged exposure to these hormones, they are probably not going to have fibroid. So that means fibroid is a disorder of people who are in reproductive age group.
There are different types of fibroid. You mentioned a little bit of it, and then which one is more dangerous?
Okay, so
What type of fibroid is more dangerous?
fibroid are different in positions, and the position usually describe the name that we give to those fibroids. If the fibroid is on the surface of the womb, it is called subserosa. That means it's just attached to the serosa covering. That's the outer covering of the womb. Usually those will not cause a lot of problem other than the place is big, there is nothing constricting it, so that fibroid can continue to grow and become very fat. But often beyond that, they may not have a lot of symptoms other than pressure symptoms. All right. Again, there is
No,
another
sorry,
one.
doctor. I need to forgive you.
Yeah.
When you said pressure symptom, what do you mean?
Okay, so pressure symptoms are symptoms that come as a result of bigness of the fibroid in the woman, not
Why is it going
because
to put pressure
on the bowels, on the bladders, on the organs around, not on the uterus itself. Another type is the one that is inside the muscle of the uterus. You know, the uterus is a thick muscle. In between the muscles, there could be some fibroid growing within it. That is called intramural fibroid. that is associated with a lot of pain. That may not grow so much, but it can also become very big as well. And then there is another one inside the womb, just under the layer of the covering of the inside of the womb. That is called submucoid fibroid. It is this type of fibroid that make women to bleed a lot. Alright, it is this fibroid that also make women to have issues with fertility, especially poor implantation, recurrent bleeding, early rupture of membrane, or even preterm delivery. Alright, there is another one that may look like a finger inside the womb. That is called polypoid. It looks like poly. It appears as if there is no other thing attaching it to the uterus. That's another type. Fibroid can also be found in the ligament that support the uterus, so that the uterus does not drop out of the woman. Inside that ligament, if the fibroid is there, it can continue to grow and block the tube through which urine is formed from the kidney into the bladder. That can occur. We also notice that fibroid can even be totally separated from the uterus. Probably it started growing from the uterus, and after a while there is a blood supply from somewhere else that continues to feed that fibroid. We call that parasitic fibroid. That can also occur. These are common types of fibroid that can occur. It can also be very close to the tubes and block the tubes and cause infertility, maybe behind the uterus, and also cause pain during acts of sex and all that. These are also variants of the ones I've described on the surface, in the muscles, inside the womb, or inside the ligaments.
Is there a particular cause of this growth?
All right. Okay, so fibroid does not have a known cause, even until now. However, we have been able to identify many things that can predispose to it. And some of these include the age. If a woman is older than 20, for example, has been having menstruation for many months, they are likely going to have this situation. So we notice that women who have fibroids usually have extensive age. You will see that people who are 30, 35, 40 and above have fibroid. So the longer it takes, the higher the risk. Number two is that we notice that some women are black, some are white. The white people don't have much fibroid like we do. So black alone is a risk factor. For example, if you look at the statistics, you will see that we have like 9 folds risk of having fibroid compared to the white population. So black is an established risk factor. We also notice that people who are obese, who have a lot of estrogen that are being converted in their fat cells, continue to feed this tumor, and eventually the tumor can become bigger and become problematic. So these are common things that can actually predispose women to it. Some people talked about food, that can some food actually have impact, but the real evaluation that we have done show that maybe we can only say is a theoretical risk, it's not a real risk that food will make you to develop uterine fibroid. However, it can worsen the symptoms of fibroid. For example, people talk about sugar, they talk about heavy starch and all those. But the only thing is that if there are food that are very rich in estrogen, these hormones are mentioned, it can be like a feeder to the tumor itself and make such tumor to grow. But it's not the cause, it's just an associated factor.
Okay, I actually want to take you back a little bit. Um, I'm sure this is not going to be like a discrimination, the white, the black. So the black have more, the black women are more prone to fibroid than the white women. Meaning that if you're a black person, an African, blacks, you have,
Not only African black.
okay, so
So whether you are a black African, Black American,
So black is black.
African. Yes, you if you are black, you have the black gene, you are at risk of developing it more than the white counterparts.
So which means black gene fibroid carriers.
Well, I may not say that. They also have fibroid in their gene.
But you said it's not as much as that of the
But
blacks.
yeah, probably some other things interplay to make us have more than them. And we also notice that the tumor size that we have is usually bigger than the one they presented with.
We need to really, really check this part of it,
Yes.
oh, because if the blacks carry more, if the blacks are more prone to fibroid than the whites, there should be more research to that.
So a lot is going on currently. When we talk about pain, all of them can actually become painful.
Okay?
So it's not like a particular type
It's
will
more
cause
painful.
pain, right? The one inside the womb usually is the commonest type that presents with pain and presents with heavy bleeding. Next is the one inside the muscles. But the one outside on the surface, like I told you, it can become very big, exceptionally big, and block many things. It can compress the nerves as well. It can compress the bladder. It can compress the rectum, so that the woman will be having repeated constipation. In fact, it can even make the woman's leg to be swollen, and they may have other signs of pressures. So those pressure symptoms can also cause pain. So that's why I said all of them can cause pain.
Pain.
Degeneration sometimes when the fibroid is growing rapidly can also cause pain. When it's trying to dissolve by itself, it can cause pain. When you are using drug to melt it, it can cause pain. And so there are many reasons why they can have pain too.
Okay, so as it is, all types of fibroid causes pain,
Exactly.
but I guess some will cause more pain than others because of their position.
All right. So, like I was trying to describe to you, the one inside the womb oftentimes would present with pain earlier than other ones because even with small size, there will be pain, unlike the one on the surface of the womb. All right. So, we can say that the submucoid fibroid and intramural can be more painful than others.
Okay. You're still tuned to Stay in the Show with Deborah, your one educative program that empowers you for a brighter tomorrow. I am your host, D to the A to the B to R A, or your one educative program that gives you that muzzle. Yes, because we said information is knowledge, knowledge empowers. And today we'll be talking to Dr. Bolutife Idowu on the issue of fibroid in women. We have been learning a lot of things, and I know so well that you have been informed with this few, discussion we've had. But let's find out more about it. Doctor, is fibroid cancerous?
All right, let me say categorically that fibroid is not cancerous. It's a benign growth that is on the uterus, but sometimes, very, very, very rarely, it can become cancerous. It has been said that 0.01% of the fibroid can actually become cancerous. And there are telltale signs that will give us clue that that is cancerous. But most fibroids are not cancerous.
Okay. People, or let's say doctors, or most people have this orientation that surgery is the major solution to fibroid. Is that correct?
Depending on the angle you're looking at it from. For example, like I mentioned that most women will have fibroid, 8 out of 10 will have fibroid, only 2 to 3 would need intervention out of that thing. And out of these 2 to 3, some of them may have huge fibroid already that most other ways of managing those fibroids may not be applicable anymore. So invariably they are left with options of surgery that will resolve the situation on time. Probably that is why many people go for surgeries. But there are other ways to also manage fibroid apart from surgery. Those 6 to 8 out of every 10 that had fibroid but didn't have symptoms, they don't need to do anything. They just need to be watchful and waiting and be monitoring their with ultrasound scan, maybe 3 monthly, 6 monthly, to look at what is happening to their fibroid. Nothing given, not a drug at all right? But those who have symptoms would need to look for help. If those fibroids are tiny, there are things we can do without surgeries. If they are big, most likely that will need surgery.
From your practice, you say that most of these fibroid do not need surgery.
Exactly.
Most of them will just be there and they will not even cause any pain or harm to that carrier.
Yes.
Most people do not need even medications for fibroid because they are causing
Exactly.
no harm.
Exactly.
While some people, just a very few number of persons,
Proportion, yes.
will need help
Exactly.
because of fibroid.
Exactly.
So it's just to say that because you have fibroid does not mean you should go to the hospital. Because you have fibroid does not mean you should start taking medications. Let me put it that way.
Okay, maybe I should just reframe it like this.
Okay.
When you have fibroid, there must be a reason why you discover that you have fibroid. Most people have some symptoms that made them to go for ultrasound scan, and the scan then mentioned to them that they had fibroid. Some people do it during their annual screening. For those who just did annual screening and then suddenly found out that they had these issues, most of them don't have problems. We'll just be watching them. All right. But for those who are already having pains, they're already having heavy bleeding, they went to the hospital and then discover that there is an issue. They cannot just be without any medication or treatment. All right. So that's why I said I need to refrain
Rephrase
now.
it.
Yeah.
Okay, so better put that women or almost every woman has fibroid, but not fibroid is cancerous. Then not all fibroid needs help,
Exactly.
but most fibroid, because of the symptoms, it begins to project. Okay, so because the fibroid in that person is already projecting a particular symptom, that person now needs help. Because for you to say, for you to feel a symptom, that means something is making you uncomfortable
Exactly.
and you now need help.
Exactly.
Okay, so now because you now found out that you have fibroid, it has to be okay. Now we're going back to this part of it. We said you have said that not all fibroid needs surgery.
Exactly.
Some other ways to manage it.
Yes.
So tell us, what other ways are there? To
Okay,
correct it?
so most fibroids would not need operation at all. Some would need operations, some would not need operations. Those who would need intervention at all, they can have some medications that can met fibroid. There are some drugs like that that can dissolve fibroid. There are also some gadgets in recent time that has been developed that are not invasive that can also help to dissolve fibroid. Example is an IFU. There are some things that can also be injected into the artery of the
Woman.
the woman that is feeding the fibroid to block it. You know, when you snuff out life out of that fibroid, after a
stop
while
growing.
it will stop growing. So that's what we call uterine artery embolization. That is also possible in this country. That can be given to some women. And then there are ways of doing surgery too for those who will need outright surgery. There is open surgery, the one you will be opened through your abdomen, what we call open myomectomy. Some people will have a bikini cut, some people will have a midline cut depending on the size of their tumor. All right. Some people will need a small machine that has a camera on it, pass through their vagina into the womb, and that can be used to remove the little fibroid they have. We call that hysteroscopic myomectomy. It's an operation, but done in such a way that it looks minor, but it's actually a major surgery. The good advantage of that is that it can a patient can go for that procedure that day and go home that same day. All right. There is another one similar to that that can be done through the abdomen. We call that keyhole surgery.
Say again.
Keyhole,
Okay,
just like
keyhole.
the hole of
The
the
key.
key. Yes. So very tiny hole is created through your tummy, and some instruments are introduced into that tummy to look inside and then identify where the problems are. This then can be removed systematically, and after the removal, there are machines and there are tools that can be used to dissolve or to break down this fiber that has been removed so that everything can pass through that small hole through which that operation has been through that port through which the operation has started from. All right, so we call it keyhole or what we call laparoscopic myomectomy, and that can also be done in this country. And beyond this, there can be total removal of the womb, and that is what we call definitive management of fiber. Because every of these other ones I previously mentioned, the womb will still continue to be there, and if the womb continue to be there, it can grow fibroid again, not because the doctor has not done a good job, but because some tiny ones that doctor cannot see at the time of removal continues to grow. Some new ones will be formed, and so there can be recurrence. Whether you use drug, it can recur. Whether you use IFU or you use uterine artery embolization or you do open myomectomy, they can recur. If you don't want them to record, that means you have to remove the womb that is their background.
I'm so glad I'm speaking to you about this because it's actually giving a lift. It's so detailed to tell women what exactly you'll be looking out for when you have such experience, when they tell you you have fibroid, what exactly you'll be looking out for, and then why you need some procedures. So you should just clear that not all types of fibroid needs all types of procedures. There are different
Exactly.
procedures for them.
Yeah.
So it's also detailed, so informative. Thank you, doctor. Now, well, let's look at this again because there are different ways of managing fibroid. The most of all is removal of the womb. Well,
Definitive.
that part of it,
It's scary. I
yes,
know. I know.
that part of it is very scary. But at what point will you recommend that for a
Okay.
woman?
Very good. So, for someone who has been having recurrent fibroid and possibly they have concluded their family size, if
Okay.
you're looking for 4 children, you already have 4 children, you can conclude by removing the uterus. That can occur. Again, you can look at people who are already advanced in age. The chance of having natural conception is very low. Maybe a woman is already 50 and above, and the symptoms of fibroid is getting too much, affecting the quality of life. You will have to remove the uterus. For such women, some of them will look at the risk of entering menopause versus the risk of continuing with their pains and all the symptoms they're having, and they will decide that it's time to remove that uterus. Some people is because of serious bleeding, and if the bleeding is so serious that you can't control it by any other way, you have to remove the uterus. Mm.
Okay. So first, if family has concluded, if a woman has concluded with her husband on
Mm.
their family side,
Mm.
in the case of a woman who hasn't had a child,
Okay, so that's why sometimes it's an emotional based management. For a woman who has never had a baby
and
but
she's
has
been
been
suffering,
having a lot of problems. So we have to look at, we do an assessment, we call it quality of life assessment. When we look at the quality of life, we see that the quality is so poor, and removal of the womb is one of those things that can give a better quality to that woman. It will be discussed with such women. All right. Most of them will disagree. All right. But
I'm already nodding my head.
some of them will say, you know what? it's time. I'm already 40, I don't have a partner, and this problem is killing me. Let me live my life, and eventually they will go for it. I've had to do a lot of this for some people who think the best way to actually be free of these symptoms is to remove the womb. But most of them are already well over 45 and above. So we go ahead and remove it.
Okay, so from your practice, there are some women who have removed their womb
Oh, plenty.
that haven't given birth.
Numerous.
Really?
Some of them have not even given birth and
And they're not married?
they don't really mind because
Okay.
there are ways to have children apart from through your womb. There's something we call surrogacy. That is possible. Adoption is possible. All you need to do is shower your love on those people.
So we're going to talk
Yeah,
about that later, not now. Okay, so it's possible if they wish to remove the womb.
exactly.
Okay. Information gives knowledge. Knowledge empowers. An informed person makes an informed decision. On this program, we discuss everything that affects your life, family, and your environment. Is there a possible way of managing them so that they can also have their child before?
Yes, there are ways to manage them. We have some things we call symptomatic management. The symptomatic management is to manage the problem that is giving them concerns. It may not necessarily be to remove the cause of the trouble, but the trouble that it has caused, we can manage it. For example, a woman having heavy flu and sometimes they collapse after their menses and they are not ready for surgery. We will not just let them be. We have to do something to make their life bearable. So we can give them drugs that will improve their blood level. We can give them drugs that will reduce the amount of blood loss that they have monthly. We can put something inside their womb that will be controlling how much of hormones and how much of blood they can lose at all right, if they will lose. For example, there is something we call Mirena that we can keep inside our womb. So we use that to manage them. Some people will be on drugs just to control pain. All right. So this can also be done without removing the fibroid. But when you're looking at something more tactical, you want to actually solve the problem of the fibroid, then we have to look at what exactly we're going to do. What is your aim? Do you want to have baby? Because if you want to have baby with your womb and the fibroid is in a position that can hinder that, then we have to remove that. All right. If you are looking at having baby but you are not ready now, maybe your symptoms is not so severe, there are drugs that we can use to just keep you in that way so that the symptoms are not going to get worse, your tumors are not going to increase more or probably even shrink them, and it can give you time. All right. So these are things we can do apart from just removing the fibroid.
I like that. I really like that because
Mm.
yes, so people will just lose this self confidence. They will just
Mm.
lose this hope of having children because they
Yeah.
are having fibroid. Okay, so obviously there are other ways of managing fibroid if you want to have a child and
Mm.
you're going through the pains of fibroid. There are other ways, and doctor has um, pointed out so many other ways which you can actually manage fibroid if you have so much of painful symptoms or so much of discomfort with fibroid, and you want to have your own child. Okay, you don't want to remove the womb. Some people don't want to go through surgery and they still want to have the child. So obviously there is hope. All right, there's always hope. Thank you, doctor. So let's see. With all this, it's so clear that surgery is not the only solution
Exactly.
to fibroid.
And in fact, we need to emphasize that because the reason why many people are going to herbalists, different teas, is because they are running away from surgery. And they need to know that there are other things we can do apart from surgeries.
So very clear, surgeries are not the only way to solving fibroid issues. And besides, you mentioned that there are other surgeries which does not entail cutting open.
Exactly. So,
So,
like that pinhole you
so the
described,
thing, the keyhole,
keyhole,
the
yeah.
keyhole,
Mm.
and there's another one you said you had
Hysteroscope.
is the rest of it. So there are these other patterns which fibroid can be removed. So it will not be, it is this nightmare people have like, so they will not cut me, open me up to remove it, and then
Mm.
sew me back. What if
Mm.
I want to have multiple children? You
Mm.
cut me again.
Mm.
It's scary. Oh.
Exactly.
It's scary.
But there are
But
other
the good
ways.
news is that that is not the only way to solving fibroid issue. And we're glad to hear that, Doctor.
Awesome.
All right. So, having heard all this, I know that a lot of us, a lot of women today, after listening to Doctor, would want to, hear, express themselves. You just might be having this challenge. You don't know how to speak. You don't know who to talk to. You are afraid of talking to someone because, it's just there that you have to go to surgery to remove it. Okay. So, doctor, are you available to talk to anyone who is ready to
Oh,
open up?
I'm available.
So, doctor is available
Yeah.
to talk to you to help you find out best options aside surgery to solve fibroid issue. So, doctor is very much available. All right, and then he won't cut you because you're coming to him. He won't cut you. So it's
Yeah.
good news to know that there are other ways that we can solve fibroid issue aside surgery. We learned all this today. It's your turn now to get a better management from an authority. And so doctor is available to attend to you whenever you are ready to speak to him. And you don't have to be afraid to tell him exactly how you feel because, like we have learned, there are different ways of managing it. So, doctor will tell us how we can reach him. All right, doctor, please tell us how to
Okay,
reach
so
him.
I'm on TikTok, Dr. Bolu ID. I'm also on Instagram, Dr. Bolutife ID. There is a phone number you can reach out to 09027045106.
That number will be on the screen, so you
So
can, copy the
you can
number
reach me
and reach
on
him.
WhatsApp there. You can also message me. You can send an email to me, Bolutife Idowu 21@gmail.com.
Okay.
So
Okay, so the number will be on the screen, the email address will be in the caption so that you can always reach him. Please feel free to reach Doctor anytime. But if you have sent him messages and he's unable to reach out to you, just be patient. Or you can also reach us back on the program so that we can contact him. You know that he will be consulting and attending to lots and lots of people because a lot of women are going through this. Thank you so much, Doctor, for your
you're
time. We really
welcome.
appreciate it.
Thank you so
We have
much.
really learned today,
Mm,
even when this particular topic is scary, but there is hope that
there
we can
is.
always get a better
There is hope.
management.
There is hope.
Thank you so much.
You're welcome.
Thank you for being part of this program. It's your host, D to the E to the V to the R A on Staying Assured with Deborah. And like we always say, information is knowledge. Knowledge empowers. An informed person makes an informed decision. Stay with us. Don't forget to subscribe to our YouTube channel. Follow us on all social media platforms and get empowered.